Hi, my name is JJames, and this is my OTD774 Conceptual Framework assignment. So in this presentation, I will discuss how the MOHO, PEO, and recovery frameworks can guide occupational therapy intervention in mental health settings. I will apply these frameworks to two clinical scenarios while discussing the assessments, interventions, and professional reasonings. So scenario one is an adolescent mental health scenario. Casey is a 17-year-old high school junior diagnosed with generalized anxiety and major depressive disorder. He was previously involved in varsity soccer but has stopped attending practice and spends most of his time isolated in his room using social media. His occupational participation, routines, and school performance have significantly declined. So, how does MOHO, volition roles, and recovery, hope, and empowerment influence mental health and well being? So, MOHO explains mental health through motivation, roles, routines, and performance capacity. When these areas become disrupted, participation in meaningful occupations can decline. The recovery model emphasizes hope, empowerment, self direction, and engagement in meaningful activities. Recovery oriented occupational therapy focuses on strengths, clients' chosen goals, rather than the diagnosis alone. So a little bit about this. So Casey's withdrawal from soccer and increased social isolation suggests a disruption in identity, motivation, and role participation. As a former athlete and student, his meaningful roles and habits have become significantly limited. Through the recovery model lens, intervention would emphasize rebuilding hope, empowerment, and engagement in meaningful occupations chosen by Casey. So for scenario one, the assessment I would use for MOHO is the MOHOST. So this can be useful because it helps evaluate motivations, routines, communication, and environmental influences which are affecting Casey's occupational participation. And with that, with the MOHO, the two OT interventions I included was trying new leisure activities and role restoration as a friend, athlete, or also with student occupations. The next assessment for the recovery model, Hope and Empowerment, I chose the COPM, the Canadian Occupational Performance Measure. So the COPM assesses an individual's perceived occupational performance in the areas of self-care, productivity, and leisure. This can help Casey find meaningful areas where he feels his performance and satisfaction has declined. And the recovery model, the two OT interventions I included was collaborative goal setting and anxiety coping strategies or graded social participation. So for scenario two, community reentry, Marcus is a 38-year-old with chronic schizophrenia who lives in a supervised group home. He wants meaningful work through volunteering at a library. However, sensory overload and transportation barriers interfere with his participation. So, how does the PEO environment, occupation fit, and recovery self direction influence mental health and wellness? The PEO model explains occupational performance through the interaction between person, environment, and occupation. Difficulties can occur when environmental demands interfere with meaningful participation. And then the recovery model supports self direction by prioritizing clients' choice, autonomy, and participation in personally meaningful occupations. So some of the assessments I chose. So for the PEO, I also chose the COPM because this can help support those client-centered goals and also identify some of those occupational performance challenges. This can help Marcus identify meaningful work goals and barriers affecting his participation in volunteering and community activities. And then two OT interventions I included with the PEO is environmental modification and occupation adaptation / task modification. The next assessment I chose for the recovery model for self-direction included the occupational self-assessment or the OSA. This can be useful because it's an evaluation that can measure human occupation across domains of skills, performance, volition, and habituation. The OSA allows us this to help Marcus to reflect on his strengths, routines, and confidence in daily occupations while supporting self-directed goal setting. And some of the interventions for the recovery model I included for self-direction included collaborative goal settings and community participation and also role exploration. And then lastly, for professional reasoning and the OT perspective, I included that the MOHO, PEO, and recovery frameworks focus on occupational participation, identity, environment, empowerment, and meaningful engagements rather than diagnosis alone. These frameworks guide occupational therapists in addressing psychosocial, cognitive, and contextual barriers that impact occupational performance. This aligns with the ACOTE standards B32 by using evidence based interventions that address psychosocial and cognitive aspects of occupational performance. And these are my reference slides. Thank you.